Good afternoon, everyone. Thanks for joining us. We're going to jump in a minute. I do want to acknowledge that today we have joining us on the phone Dr. Jeffrey Nicastro from Nuvance. He's on the phone with us this afternoon. We're going to talk a little bit about the medicine, the science behind the vaccine, and if you have a question regarding that, please, or anything actually, just write it in the comment section below the live stream. But before we get started, today, January 20, is Inauguration Day. In this country, on the 20th of January, in accordance with the Constitution, every 4 years after an election is the transfer of power. And I, for one, on behalf of this community, cherish not only this day, but the document in which you find this brilliance, this transition from one leader to the other. And it is unlike anywhere else in the country. And so on behalf of the people of Dutchess County, we not only congratulate and welcome President Biden and Vice President Harris, we also wish them well. We pray for their success, for their health, for the courage, compassion, and wisdom to work to bring this country together. Compromise is always necessary. You can't call for unity without finding ways to compromise. You cannot call for peace without trying to find unity. In this nation deserves the very best. So on behalf of the people of this county, on behalf of my family, myself, we congratulate, we welcome the President and Vice President. We cherish today, and we hope that God might grant them the courage, the wisdom, and the compassion to do well by all of us, to serve this country well, to help us rebuild, to help us continue to respond to this pandemic, and ultimately to find new ways to heal and achieve success. And may we celebrate our differences, may we celebrate the differences that we have of opinion, but may we always do it peacefully, and may we find ways to challenge each may we find ways to challenge each other to be better and to do better. And I, for one, commit, as I have every day, to that very challenge. So God bless them, and God bless the United States of America as we transfer power today to the new President and Vice President of the United States. Let's jump right to the dashboard and get to some of our data points. We are now monitoring 2,335 active cases. We continue to see obviously increases, although I again would tell you that the rate of growth has slowed a bit, but 2,335 current active cases, 147 current hospitalizations. Now that is down from last week, and we have seen a little bit of a decline in hospitalizations, but that is also, we've also seen in the last several weeks a steady and sad increase in deaths. 319 Dutchess County residents have succumbed to the virus. And just as a note, this county paused last night with communities across the country in observance with the bipartisan inaugural committee to recognize those lives lost to COVID-19, the virus, and during this pandemic. And certainly we extend our thoughts and prayers to those families who continue with significant loss. But 319 deaths. January has proven to be, sadly, the deadliest of the months that we have been engaged together in this pandemic response, and too many Dutchess County residents have lost their lives to the virus. That being said, remember, if we continue to engage in those mitigation steps that we've talked about time and time again, we know that we can slow the transmission of the virus, and as vaccines start to find their way into our community, those steps will hopefully together slow the transmission of the virus and ultimately save lives. We are now at a 7-day positivity rate of 8.01%. That is down from where we were late last week of over 9%. So we are seeing somewhat of a decline in the rate of positivity. But again, hospitalizations, even though we've seen the rate of growth sort of stabilize, we are still seeing, however, the severity of cases and new cases. So we'll monitor that. We continue to focus, obviously, on responding. We just ask you to be patient. We know that this has been a long year, and there are going to be longer days still to come. but we are seeing at least the light at the end of the tunnel. And starting with that, of course, has been, or to continue with that, has been the rollout of vaccines and access to vaccines. I share your frustration. This is not the way the vaccine plan was to have been rolled out in the state of New York, as you likely know, because we've talked about it. County health departments function as, in essence, extensions of the state health department. We create vaccine plans. In fact, we create and update annually a vaccine distribution plan, and for whatever reason, the state of New York decided not to engage those plans. Now, there is an attempt to catch up, and there are certainly opportunities for the counties to expand and to grow, but right now, demand for the vaccine exceeds the supply, and by significant numbers. So let's keep in mind that currently the state has identified who qualifies for vaccine. We're in the phase 1A and 1B categories. You can see those there on the screen, and with that, they've established who really should be focused on providing vaccines to those populations. Currently, though, just as a reference, seniors in Dutchess County, those who are 65 years of age and greater, represent about 50,000 residents. So 50,000 Dutchess County residents qualify as a senior. When you add that, those essential worker populations, the healthcare worker populations, and all others, we're talking a significant number of people. Let's say, obviously exceeding 50,000 residents. And just as a reference, this week, the state distributed some 1,200 doses for first-time doses to Dutchess County. That is not unique. Across the state, there was a reduction in the number of doses being distributed. But just as an example, the federal government reduced its flow of vaccines to the states. This week, New York received some 200,000 vaccines. That is about 50,000 less than the week before, and we have access directly to 1,200 vaccines here in Dutchess County. So, as a point of reference, we have established in Dutchess two points of distribution, very limited, as I mentioned this week. Dutchess County's two points of distribution, one at the JCPenney's, former JCPenney's at the Poughkeepsie Galleria, one at the Dover High School Middle School. We are distributing 600 doses. That is it, 600 doses. And all of those slots have been scheduled and are accounted for. So I do want to encourage not only that you be patient, but we cannot take walk-up vaccines. You can't just walk into those locations and get those vaccines. So to the extent you can, please visit. I know you're online because here you are. So please visit dutchessny.gov/COVID vaccine. You'll see a blue button that says subscribe now. Click that button. Now, over the course of the next couple of days and weeks, you'll see that subscription will likely be a little bit more detailed, but for now, we're looking for email address, and as we get your email address, we will provide you vaccine updates. Some people have said, I signed up and I only got one update. Yeah, because at the moment, that's the only information the state provided and the only information we could give you. There will be some more regularity as supply increases, as there's new data to provide you, and there's new opportunities. You'll get more emails, but right now, as I said, if you sign up for that, and that blue button, if you sign up for that, you'll get an update as to the availability of vaccines in Dutchess County. So we encourage you to do that. Please don't call the health department looking for an appointment. We can't provide you an appointment via the health department phone number, but just as a reference, we've received over 7,000 calls in the past week. 7,000 calls in the past week, and that just is obviously we're not equipped to handle that number of calls. But if you're looking for an appointment, we're just not able to do that. The state of New York controls this process. This is entirely organized and structured by the state of New York. Let's do a couple questions, and then let's jump hopefully to Dr. Nicastro. First, these are for us, Doctor. You can hold on a minute. The question from Alana: when will more vaccine sites be open? Will school open their own for staff? So the short answer is when the supply increases, there will be more opportunities for both locations and appointments. But with only 1,200 vaccines being distributed to the county this week, we could open up dozens of sites. It just wouldn't be worth it. So as that flow increases, and we expect that the federal government will release more into the system, if you will, and then the states distribute more. As far as schools, it is the intention of the state to provide larger employers the ability to have pop-up vaccine sites, but none of that will happen until there's enough supply into the system. So be patient, but that is not going to happen in the near term, and we're likely looking at several weeks and months of continued expansion of access to the vaccine. When will more vaccines be available to everyone? Andrea, excellent question. What I can tell you is, as I said, last week the state of New York received about 300,000 vaccines statewide. They were distributed across the state. This week the state is receiving some 250,000 total vaccines distributed across the state. That's from the federal government to states. It is expected that there will be an increase in distribution from the federal government to the states. The president said prior to taking office that they wanted to activate the Defense Production Act, which would enable the production of more vaccines. As that increases, there'll be greater distribution. Deirdre, how can I get my 86-year-old mom vaccinated? She can't travel to Westchester. And Deirdre, I believe me, I feel for you and I understand. So a couple things. Number one, the state has set sort of expectations for who is providing vaccines. Currently, they don't have enough, but currently pharmacies, including Rite Aid in Dutchess County, so Rite Aid and others, they are expressly instructed to provide vaccines only to those who are 65 years of age and older. So if you're under 65, you're not going to get your vaccine from a pharmacy. If you are over 65, you need to go to their websites, go to their direct location. Don't go over there physically, but go to their websites, look up their availability, call your local pharmacy, see if they're available. You are asked to go to your doctor and your pharmacy. And again, I understand the frustration because there aren't enough doses. The pharmacies only have 50 to 100 this week to distribute. That's hardly anything. Physicians didn't receive full certification from the state to open up new vaccine locations. Now again, the supplies aren't there, but the state has got to ramp that up so that you can get to your doctor. So at the moment, if you can travel, the state is directing you to either your pharmacy or to one of those state pod locations. You can sign up with us, but the counties are asked to focus on essential staff. We don't necessarily embrace this as a model. We think that county governments, because we're responsible to everybody, ought to be focused on providing a great access to those who would not have access otherwise. I'm an avid reader of Senator Daniel Patrick Moynihan. He was a U.S. Senator when I was a lot younger. He used to say, although with a little more raw language, he used to basically say that governments are responsible to provide for the things that people can't get anywhere else. So the state's saying to us that our job is only to give it to those who do have the ability to travel, who do have other access points, isn't the most logical, but we're making it work. So our goal is to get you access as the doses increase. You can sign up for that distribution information we provided, but at this point, seniors are directed to your local pharmacy and to those statewide locations. Okay, so those are a few questions that we've gotten so far. Harvey asked, I have a first shot appointment at Rite Aid. Will I get more information on the second shot? Yes, Harvey. If when you get your first shot, they are also to schedule your second shot. Now I know some of you got doses at some locations. I don't know if Dr. Nicastro will be able to answer that, but I think there are certain locations like I think Vassar and others that did provide first doses. In some cases, not everyone got their second dose. That has been clarified. Second dose appointment. That has been clarified. The state of New York, we are telling every provider that when you give that first dose, you must also schedule your second dose. So if you came to Dutchess County's pods, you would have that happen. So Harvey, yes, Rite Aid is to schedule your second appointment. And I'm going to suggest to you, if somebody doesn't say it to you, when you're there, you say, you're supposed to schedule my second appointment, and make sure you get that scheduled, because basically you're blocking the use of you're locking in the use of a dose for that time when you come back, right? Right now, Dutchess County, for instance, this week is issuing 600 doses at our points of distribution. In a week or two, we're gonna have to start giving the second doses. So those are already taken; they're already spoken for. And so obviously you want to be able to do that so that you have access to it. Bill, good question. How do we contact other sites about appointments? Let's go to the state link as well. I'd like to provide you that. So a couple things, right? You go to our site, you can link up to our site. You also can go to ny.gov/vaccine. This is the Am I Eligible information through the state of New York. Or you can call toll free 1-833-697-4829. 1-833-697-4829. That will give you access to schedule an appointment at one of the state locations. Again, big demand. A lot you're traveling, not the way we would do it. It's the way the state's doing it, but we encourage you to go through that process. The system is really very fluid. But we're encouraging you to be patient. You can go directly to your local pharmacy website as well and link up if you're over 65 to an appointment there. Linda, why is the supply so limited? Short answer is we're getting the distribution from the federal government to the states. All I can tell you is it's also a factor of the fact that there are 300 million Americans and everybody wants this now. And in some cases, it's like chasing a unicorn. But keep in mind, the production will increase, supply will increase, availability will increase. We've all said from day one, the average individual is likely not to have gotten the vaccine access until late spring. It looks like production is going to ramp up, but still this is a multiple month process, and we encourage you to be patient and to stick with us. We'll give you that information. We're going to go to Dr. Nicastro with a question from Deborah. So, Doctor, hope you're ready. Thanks for joining us. We appreciate it. We're going to also have from time to time medical professionals to talk a little bit about the vaccine. Dr. Deborah is asking, how soon does the vaccine become effective after the shot? So maybe speak to the effectiveness of the first shot, when and then why and when you would get to the second shot, and then I'll go back to another question. Go ahead, Doctor.
Okay, well, thank you, Mr. Molinaro. Thank you for having me here. And Deborah, the answer to your question comes from the studies that were published from both Pfizer and Moderna on their vaccines. In the Pfizer study, there was a 58% effectiveness of the vaccine after the first dose, after about 7 to 10 days, and before the second dose. After the second dose, the efficacy or the success rate of it was between 94 and 95%. So it's a great vaccine, and it even has some efficacy in terms of preventing disease after the first shot. Moderna was similar, only even a little bit more efficacy or success in terms of preventing disease after the first shot. And again, 94 to 95% after the second shot. Hopefully that answers your question.
Yeah, I think it does. And why don't I offer you this question? Could you explain what exactly the vaccine is? This is not like the flu vaccine, and maybe a little bit of the science behind this messenger RNA.
Sure, I'd love to do that. I'm going to tell you that it's a little bit complicated, but not really too much. So messenger RNA. What does messenger RNA generally do in our body? Well, it's the code that tells the mechanism inside our cells how to make proteins. That's basically what messenger RNA does. In this vaccine, we're injecting a messenger RNA that has the code for part of the spike protein on the COVID-19 virus. And so the injection goes into your muscle, the muscle cells take up the messenger RNA, and the mechanism in there start to produce these spike proteins, which then your body sees and create an immune response to. I want to stress that when you're not getting virus, you're not getting anything that can produce the virus. All you're getting is a little blueprint that allows you to make a piece of the spike protein that would be on the virus if you had it, so that your body makes antibody to that spike protein. So if you do come in contact with the virus, your body already has defense against it.
That might be the simplest I've heard that explanation. So we appreciate that. And so there is the concern, Doctor, that these folks developed this vaccine overnight, and sort of the concern that it seems so rushed. Now, we've been advising folks that this is actually both a science, a medicine, and a technology, if you will, that has been studied and sort of developed over years. Can you talk to the concern that folks have that this was like overnight dropped on us, and why that isn't necessarily the concern?
Sure. Well, I understand the concern, and I think that if I weren't in medicine, I might have the same concern. But let me address it. Number one, mRNA vaccines are not new, as you say. They've been around for years. This is one of the first times where that we've been able to operationalize an mRNA vaccine that is this level of efficaciousness, and so that's why we're using it. But keep in mind, although it may seem fast, number one, because we gave it a moniker, right, Warp Speed, but also because it's only been a year really that we've been dealing with this. A year seems like a long time to those of us in the medical profession who've been dealing with this, but in the world of developing things, it's not long. But keep in mind, every major drug manufacturer, every major research center around the world has spent a substantial amount of time working on this. So if you were to lay that out with just a few people working on it the way it normally is, it would turn into years. So we've done many years worth of research and testing in 1 year. And so I want to reassure everyone out there this was not rushed to market without the same level of scrutiny and care attended to it that would normally be.
Thanks, and I know that I told you we told you we were going to ask this question, but there is this online conspiracy that there's some sort of technology being inputted into your veins, and I don't mean to make light of it, but everyone hears something and they hold on to a bit of information. There's no sort of mechanics or technology that's being inserted through this vaccine, right?
There is no microchip or anything else that we might have seen on media out there. No, not at all. It's exactly what I described it as.
And fair enough. And again, we have spent 11 months just giving people good information. So the fact that we hear or read things is perfectly fine. We've advised folks, there's no Dr. Facebook, that social media medicine is not the best science, but they can bring their questions here, and I don't want folks thinking they can't ask even a question that somebody else might find silly. So I appreciate that. Doctor, we're going to go to a couple other questions that are not vaccine specific, and then we're going to jump back to you. So hold on there, and we'll continue to move along on these. Sean is asking if the pharmacies are charging a fee. Vaccines are not. Vaccines are free. There is no charge for the vaccine. And so there should be no charge, and if you're aware or that becomes a concern, you should reach out to us. Tamara? I work at a school. Why can't I get vaccines at Rite Aid? Because the state of New York says so. Again, not the way we think this should work, although I would offer to you that pharmacies are not as equipped to administer these vaccines in bulk as they would, for instance, the flu vaccine. And actually, I'll get to the doctor in a moment about some of the impacts that folks have experienced. I'll talk a little bit about that. So the pods, these facilities that we set up have recovery space. The hospitals have the same, where you can get your vaccine. You kind of wait a few moments, make sure that you're feeling okay, and then you can move on your day. That doesn't all exist at pharmacies, although it does to some degree. But that said, they're not necessarily equipped for mass vaccinations of this kind. And the state is dictating who can offer what to whom. Now, we believe that the government should be there for the people who don't have access otherwise. So we'll push back a little bit on this concept that we can't be supportive to all populations, right? The state's saying focus only on essential public workers. We want to do that, but we also want to provide access to the most vulnerable among us, which includes seniors who are shut in, those with disabilities, those with vulnerabilities. Those are the things we want to, and by law, we are constitutionally obligated to do. But the state has said pharmacies are 65 years of age and older. Denise, can we see the doctor's explanation in writing somewhere? Yes. In fact, what we're going to try to do is start assembling some links that we'll provide that people can review. I encourage folks, and perhaps Dr. Castro will point to another location, but I encourage you to follow or to link up with the Mayo Clinic. They have provided, I think, really good digestible bits of information you can read a little bit about. What I'd offer to you is not every publication is credible on everything, right? So I know that there are folks in different, sort of publications and journals that write things. They're not always as credible. So it's a lot of information that sometimes looks really, sort of scientifically proven. Sometimes it's just an exaggeration of something else. So we just ask people to be cautious about the information you're getting. And I encourage you to reach out to your doctor, your pharmacist. I've been asked many times, should I wait to get the shot? Should I get the shot? I'm not here to tell you what you ought to do. I will get the vaccine. I believe that it is safe to get the vaccine. I believe and I understand the science for myself. We want to maintain that right to choose. But you ought to speak to your physician, and you ought to talk to the medical professional you feel most comfortable with, because they're likely to give you the science and the information you need. And again, we appreciate Dr. Nicastro being here, and we appreciate taking some questions as well. Let's see. I'm trying to get to a few that are specific to the vaccine. Okay, slow down the questions, Lauren. Let's see. I want to see. Oh, let's do this. Okay, Dr. Nicastro, Stephanie's asking about the vaccine. This is her word-for-word question. How can we trust the vaccine if the common cold is also a coronavirus and has no cure? So let's talk a little bit about the virus, the common cold, and the vaccine. Can you decipher that a little bit?
Well, the difference in different families of viruses can be quite substantial. So the common cold isn't a particularly severe disease. This coronavirus, COVID-19, which is a variant of the SARS-CoV virus, that's why it's called SARS-CoV-2, is one that potentially can be quite a serious illness. To be fair, most often people, it's a self-limited illness. They get a flu-like illness. If they get symptomatology, all and get better, but a substantial number of people will go on to get very, very ill from this disease. That's why so much focus has been placed on it. That's why a vaccine was developed and rolled out as quickly as it was to prevent those folks who are going to get very, very sick and even potentially die from this disease. So the reason to get it is that the vaccine works based on an excellent compilation of data, and the disease can be quite serious, and we want to prevent it, and we want to prevent any more than hundreds of thousands of people who've passed away already from suffering.
Sure. So I'll ask, is it that we can't come up with a cure, in essence? And I assume we can come up with a vaccine for the common cold, but the lack of severity of that particular disease, illness, has really not necessitated the need to invest in that kind of science. Is that a fair?
Yeah, I think that's a fair analysis, but I think it's more we should compare it more to influenza.
Right.
And while the different strains of influenza change over time and over years, we still have very efficacious vaccines against influenza, and we do encourage everyone to get those. So I'd more make the analogy to the flu and just say this is more akin to a severe flu that has a substantial mortality, and just say that's why we really encourage people to get it.
Right, and because of the severity of some of the of the flu to some and well, to many, we've invested the science to try to come up with a vaccine to control that. And again, to your point, this messenger RNA is a unique address of the coronavirus, of COVID-19, and different from the flu vaccine. So Alana is asking, and I know that a lot of folks have read about what folks refer to either as side effects or symptoms of the vaccine. We really encourage people to simply to talk about reaction, right? Some people have some reaction. I know when I get a shot, any shot, I have a reaction. It's usually just a little bit of soreness in my arm. Can you talk a little bit to the concerns folks have regarding what they'll term side effects, but I think is best to refer to as sort of reaction to the vaccine. And by the way, as I understand it, and we have seen some data that suggests the second dose in some of, I don't know if it's Pfizer or Moderna, we are seeing a little bit more regular impact, but not to be concerned. But it does seem the second dose, at least what we've read. There is some reaction to among some people, and again, it's a fraction of a fraction. But go ahead.
Well, Mr. Molinaro, first of all, the people who are listening to this should be comforted in the fact that your county executive knows a lot about this medicine. So
I just read
probably
a lot.
more than he ever wanted to know, but he certainly does. So everything Mr. Molinaro is saying is true. So like all vaccines, many people, if not most, get some local reaction at the injection site, some soreness in the arm, maybe a little bit of swelling. No different with the COVID-19 vaccine. Others actually get some aches and pains or even a fever after getting immunization. Those types of minor responses are seen as well in this. Severe reactions are very uncommon. I will personalize and tell you that I got the Pfizer vaccine myself. And as an example, this is typical. The first injection that I got a little soreness in my arm, and it was gone in 24 hours. I got the follow-up vaccine more recently, and while my arm didn't hurt anymore after that, I did about 24, 30 hours later. Felt kind of tired, dragged a little bit, and had a little bit of a fever. Again, that lasted about 4 to 6 hours. That's kind of a typical scenario after the second in the series. We hear a lot about. Some people have absolutely no response, really, to either the first or the second vaccine. In the Moderna one, we've just started giving some of the second doses because it was a little later to market. We're expecting the same. A little bit more likelihood of low-grade fever, potentially some aches and pains, or a little bit of feeling tired after the second dose.
So in the case of any inoculation or vaccine, there's always the potential for a limited or a severe impact or side effect. Is there anything unique about this particular vaccine that would suggest that there's more of a concern? I know, for instance, you get your flu shot. We do have, sadly, people could have a severe reaction to a flu shot or to a polio shot. This is not that much different. I mean, there's always the risk. And you need to sort of make that judgment based on your own, history as it relates to inoculations, but also a conversation with your own physician. Is there any reason to believe that this is somehow more severe, or we know we're watching it more, so we're paying attention more?
I think there's no reason to suspect it's any more that there's any more of a severe response likely after this vaccine than any other, and we are watching it very carefully, and we've seen very few severe responses. So we're becoming even more comfortable. So yeah, nothing. This is a typical vaccine.
So there are some that have asked, and we've seen, comment to us regarding, I guess, some publication that was referring to questions or concerns regarding infertility, and this particular vaccine affecting one's fertility. What's the science and what's the data behind that claim?
There's really no data behind that claim, and there's no reason to suspect that this would have any impact on fertility.
Okay, and the discussion that we've read about the use of fetal tissue. What's the connection between that and the vaccine?
Yeah, I'm still trying to figure that one out. None that I am aware of or that I've come upon.
Okay, fair enough. And so you're joined this afternoon. We're joined by Dr. Jeffrey Nicastro. Dr. Nicastro is the Chief Medical Officer at Nuvance Health, and we're grateful, Doctor, that you're joining us. We're going to go to a few non-vaccine questions. I think we're going to keep you on the line just in case we jump back to you. And we have a lot of questions, so I'm going to try to, Sean, just stick to the questions at this point. I don't know if we're going to do much jumping back and forth. Let's do. Linda is asking any info on appeal for New York indoor dining. There's no change in the state's guidelines. We still remain in an area where restaurants can function at 50% capacity. There's been no change in that, and I have to tell you, I don't think it's going to get any stricter. The question is, when will the state relieve some of that? And I think that there's certainly some movement. The governor spoke a week ago about the desire to open up the economy. I'm only laughing because I think we all feel a little bit like that has been on our minds for a while. But that said, no change there, and our restaurants can continue to function at 50%. Moreland, do we still have to wear masks after the second shot, and why? You know what? I'm going to get to the doctor with that question in a moment, but let's jump through a couple others. Are library staff considered education for vaccine eligibility? I don't believe that library staff are considered education staff currently under the state guidance. If I find out otherwise, we'll correct it either before we close today or at some time very soon. Heather, how can someone without insurance get a vaccine? Insurance is not required to access and get the vaccine. You can get that. You can get the vaccine if you're over 65 at a local pharmacy. That's the state's direction, although there's very, very little supply getting to them at this point. Any one of the county government and the county health department points of distribution, you can get access, no insurance required. Now, the pharmacies are allowed to charge an administrative fee, but it ought to be nominal, and please advise us if you hear otherwise. But there is no fee for the vaccine itself. And no insurance required. So those locations and the state location, no insurance required, access the vaccine. Bill, I signed up for notification emails, but they were booked as soon as the vaccine email arrived. Did someone have advance notice? No one has advance notice. No one has advance notice. There are 10,000 people or emails on that distribution list. And so 25,000, pardon me, there are 25,000 emails on that distribution list. And now we're going to update the way we share that data, only so we can make sure we're kind of giving the populations that have other points. So those are 65 and older can go to a pharmacy. We'd like to share with those residents that opportunity. So there'll be an opportunity to make the sign up and how we distribute that information a little more refined. But Bill, I have to tell you, if 25,000 emails get that, it's likely to go in just a few minutes. 600 doses is all we have for this week. Now, we expect that to increase, and there will be more opportunities. So be patient. You're going to get more emails from us, and you'll be able to sign up. When I sign up, can I also register my husband and son? Joe, you can register anyone who qualifies, but they have to qualify in those categories. If your son is a teacher, or your husband is a healthcare professional, or maybe, Joe, you're very young, but your husband's over 65, you can sign them up. But again, only if they fall within those categories. So please keep it in mind. Teresa, can't get my elderly parents appointments. Why open more groups to make it more difficult for the first group? Good point. Again, all directed by the state of New York. A lot of states have, and we all sort of, we all encourage, obviously, to try to get as many people to the vaccine as possible. But you are correct. With so few doses, there's just not enough to provide access to everyone that is qualified currently. Now, hospitals are being directed to focus on the 1A category. Those are principally the healthcare workers. They have to finish that, so they're not getting new doses. In fact, not even new doses this week. The hospitals, but they're focused on healthcare. Pharmacies are focused on 65 and older, and then local health departments are supposed to focus somewhat on essential workers, which is an enormous swath of people. But that's where we are. Phyllis, when other sites have vaccines, do we sign up with them or the state or the county? My recommendation, anyone, is sign up for whatever appointment you can get. And then as other locations become available, if there's something more close to you and you can get that appointment, then my suggestion to you is you make that appointment and cancel your other one. But if you're interested in getting the vaccine, you're willing to drive an hour to Albany or an hour to White Plains because you can get to those locations, I'd take that appointment. And then just keep an eye out as we update the availability. If there's an appointment closer to you and more timely for you, just cancel out, make that appointment and then cancel out your other. Amber, local unions organizing clinics to vaccine seniors, the public. So the unions are not going to be mobilized for public distribution, but just as we did in the 1930s, a long time ago when I was very young, actually my parents weren't even born yet, but nevertheless, there will be a certification for larger employers like trade unions and even schools. There will be an opportunity for those employers to have vaccine distribution, but that is only when there's enough doses. 1,200 doses in Dutchess County this week. Opening more locations is not going to be helpful to anybody. Okay. Let's go back to Dr. Nicastro on a few questions related to the vaccine. Dr. June is asking, how long is the vaccine effective? And I don't know that we know that, but go ahead.
Yeah, so again, June, it's a great question. We don't know if the vaccine is like other vaccines against similar type viruses, then we expect, somewhere in the 6 month to a year efficacious time zone, but that's speculation. We don't know right now, and we'll be following everyone who's immunized very carefully as we move forward to try to determine that.
Is it generally, is it expected, or the hope, certainly the hope is, I would think the average person's hope is, but is the science behind this the expectation that at least for COVID-19, the hope is that this is a one-time vaccination, that this is not going to be an annualized sort of flu-like vaccine, or am I just wishful thinking?
Well, listen, everybody is wishful, but I think that again, the science is unclear, so we can't rely necessarily on the science in terms of how long this the immunologic response will be maintained. But given the nature of the nature of a virus, and given its relationship to other viruses, I think the best guess would really be that this may act more like an immunization against influenza than something that becomes more permanent. But that's, at this point, speculation. It may well be that there's prolonged immunity, or it may be that this is something that does need to be distributed on an annual basis. We'll see.
So Kate is asking specifically if there's any, if there have yet been studies or data on the vaccine for children, and I'll add to her question. Just to offer, if you would, why is it? Currently it's 16 years of age and older. I forget what the breakup point, and why would it be? Why would it be then that there's emergency use approved by the FDA for, in quotes, adults but not children? And what science behind what data do we know or have regarding its effectiveness on children?
Right. So there is no published data for either of the vaccines we're giving out right now for children under the age of 16. So that's why the recommendations are the way they are. There are ongoing trials right now in children, and I suspect that we will have similar data to what we have on adults. I don't have the results yet, but we'll have similar data than for what we have on adults coming over the next months. And then we hopefully will be able to expand to children.
So let me offer what might be just sort of I don't think an ignorant observation, but probably one that is sort of logical. It is easier for us for the FDA and for those who have to study effectiveness. Obviously, for an adult to choose to participate in a study is their choice. For children, it's a different mechanism, right? It's that we don't necessarily test these things out on kids as easily as perhaps pulling together a pool of adults who choose to participate. Some of that has to do with why emergency access would be granted to an adult versus a child. Does that seem like a fair observation?
Well, I think informed consent's an important element,
Yeah.
and I think it's fair to say, again, it's not a scientific statement, but it's fair to say for those of us who are parents that we're much more likely to give consent for ourselves to try something that's unproven than to give consent for one of our children to have it. So it's a little harder to carry out studies in children, but you still can do it, and they are going on, and hopefully we'll have information soon. Fortunately, and this isn't uniform, but fortunately, it appears that the transition to severity of disease is far less likely in children than it is in adults, and so that's good.
We're just fortunate that we don't allow our children to be the ones who provide consent on testing our parents, because there would be almost universal approval.
Pretty sure my kids would offer me up. Right
Absolutely, my kids would make me a guinea pig. Not my wife though. They like her too much. Their mom, they might not offer her up. So 2 questions. One I mentioned, Marilyn is asking, do we still have to wear a mask after the second shot, and why? And I think that's a good point. Why? So the effectiveness of the 2 doses at this point is in the high 90s, 98, 99% effective. What is the reason that we would have to still wear a mask?
Right. So I love that question, and I'm glad somebody asked it, because again, there are a lot of things we know about this disease, but what did we study? How effective are these vaccines in preventing symptomatic illness? And they were exceedingly effective, as you pointed out, about 95% efficacious in preventing symptomatic disease. What we don't know is how many of those people who didn't get sick could still have harbored the virus, therefore able to transmit the virus, and just weren't sick. We don't know that answer. And so until we know that answer, absolutely, we should continue to wear our masks where appropriate, socially distance, and practice good hand hygiene, because we do not know whether, even though you're protected, whether others are protected as a result.
Good. It's a good question, and I understand why. I mean, I think folks, they want to stop wearing masks and getting back to, sort of the way it was, and don't understand why, if we have the vaccine, why would that be? But that's an excellent point. And
Mark, if you don't mind, if I could just
please,
make a point
I don't mind
on
at all.
that, if that's okay. Another thing that I'm going to point out is that the flu season this year has been extremely, extremely low compared to previous years. And it's not a long reach to say that the public health measures that we put in place to combat COVID have really contributed to a diminution of the amount of influenza we're seeing. And influenza is not a trivial disease in many people. So I hope, no matter what the studies show about our ability to transmit, we consider the public health measures that we're using right now, at least during flu season. Just an editorialization.
No, I think that's fair. We've gotten questions all these 11 months. Well, whatever happened to the flu? Well, the truth is we continue to track the flu, but if we're all taking these basic mitigation steps, and we kind of laugh, my wife was the first to laugh at me as I gave my first instruction to people to wash their hands. But nevertheless, not that they needed it from me, but yes, we take those sort of personal hygiene steps. We monitor our own health. We engage in those mitigations. We're not likely to spread any disease that of this kind, and so of course you'd have a reduction in that kind of transmission. So, good point to make. So, we're getting another round of questions, and sometimes we get viewers that come in midway. But right now, Pfizer and Moderna both are a 2-shot vaccine. Why is that, and what is the effectiveness of the first shot? And could you still contract the virus after getting that first shot?
Right. So I think that we mentioned earlier that there is some protection after the first of the series of 2 vaccines. I think the number that was published in the FDA bulletin regarding the Pfizer vaccine was somewhere around 58% or so efficacious after the first in the series, but after the second in the series, the efficacy was 95%. So the reason to get the second shot is to really be protected, even though maybe the first one will afford you some protection. So please, you should complete the series. Why was it? Why was it?
Why is it 2 shots?
Why was it developed this way? And it was developed this way because in early studies it was clear that the 2-shot vaccination schedule would have the best efficacy, and so that's the road that it went down.
So I'll ask out loud. How did they come to that conclusion? Did they identify this potential vaccine, and they realize after studying the first shot that it's just not enough, so we need a booster, or is it actually studied as a 2-shot kind of effort? Or am I asking a question that maybe is just far too ignorant?
Well, no, it's not ignorant. It's a little bit outside my bandwidth.
Okay.
But the phase 2 trials, the phase 2 and 3 trials, the ones that we're referring to describe efficacy, were all the 2-shot series for both Pfizer and Moderna. Studies that came before that suggested that would be the best way to go, and so the studies that we're looking at that compare like 18,000 people who got the vaccine and 18,000 who didn't, all got the 2-shot series.
So Nina is asking about the Johnson & Johnson single shot, which we've been following as well. Do you know much about their timeline and the science behind theirs? Why would that be a single shot?
Yeah, so that's a completely different vaccine. It's not an mRNA vaccine. It's a vaccine that is developed by putting some of the elements of COVID-19 that would be recognized by your body's immune system in a much less serious virus, and now allowing you to develop immunity to those elements that are also part of the COVID-19 while seeing sort of a benign virus.
Is that more akin to the traditional flu vaccine?
It's akin to it's the type of vaccine, and there's so many different ones with so many nuanced differences, but it's more what people out there are probably accustomed to.
Okay, fair enough. Doctor, we have kept you for 45 minutes. We appreciate it. I have a handful of questions that are not vaccine related. So we're going to let you get on your way. Any last thoughts you want to offer folks who are listening? I think if anything, to the extent you can, allay the concern or address generally the skepticism, I think is important. There are those who are going to choose not to take the vaccine, and I respect that. But there are those that we don't need to convince them. I think they just don't. They're just a little bit concerned about it. Maybe you can offer just some general comment about that, and then we'll let you get back to work.
Yeah, no, I'd love that, and thank you for allowing me to share with you guys today. So I think that the safety and efficacy or effectiveness of this vaccine have been well determined by the science. And that's what I believe should be the thing that alleviates people's anxiety or concern about this. I ask everyone, we have the internet now. Most people have access one way or another to it. Do your own research on it. Read a little bit about it. The bulletins from the FDA are easy to find, and couple of page executive summary, very good. Ask your doctor. Ask your pharmacist what they think. I will tell you personally, I got the vaccine, and I will encourage the rest of my family to get the vaccine. And I think it's safe and effective, and that's what the science tells us. And I suspect that's probably what your physician will tell you, or your pharmacist, when you reach out to them or you do the research yourself. I would also, again, just from an editorialization standpoint, I believe the vaccine is the light at the end of the tunnel of COVID-19. But the tunnel has been long, and we're not right near the end of it quite yet. And the best way for us to mitigate the impact of this disease right now, in addition to getting the vaccine when you can, is to continue to wear your mask, socially distance, practice good hand hygiene, and let's try to protect one another from this until we start to see it die down as a result of sort of global immunization. So thank you for letting me be here.
Doctor, we appreciate it. You're likely to be back with us in the future. Our goal is to have folks from Nuvance, from Westchester Medical, sort of interact, and other networks provide some guidance for folks who have questions. And please, on behalf of the nearly 300,000 people who call Dutchess County home, please extend our appreciation to all of the people you work with, from the offices to the floors. We have a tremendous healthcare community who I know has dug deep these last 11 months, and I can say personally, well, not in your network, but certainly of the same ilk and the same kind. Healthcare professionals, from custodians to doctors, I know helped keep my father alive a little bit longer. You all have done an amazing amount of work, and we're grateful for that. So thank you, Dr. Jeffrey Nicastro, the Chief Medical Officer at Nuvance Health. We'll probably have him back sometime soon, but we appreciate his participation. Let's get through as many questions as we can in these last few minutes. I don't want to cut anyone off, and you've had questions that are not vaccine related, and I think it's important. Kathy, will the county seek guidance on immunocompromised not being in 1A or 1B? Yes. I mean, I will tell you, our position was early on, open up to 75 years of age and older, and those with immunocompromised or health vulnerabilities. We're asking for that, but understand, as the spigot opens even greater, there just isn't enough dose. There aren't enough dosage coming into the community to provide to provide access. Benjamin, how long do you know if a positive test is the new strain of COVID? So there are strains, right? There are variant strains of COVID-19. You know that. I refuse to call them by some national name. I don't think that that's appropriate. But there are different strains that we've identified. As I understand it, the labs pretty much identify them shortly upon confirming positive, that they're identifiable by the labs when that positive is sort of confirmed. So we would know that relatively quickly. We'll confirm if my answer wasn't all that accurate, but I believe that's what we know at this point. Lisa had a school question. Noreen, are employees who work on school and prison sites and construction eligible? So let's go to 1A, 1B. Let's just remind folks what they are. 1A, high-risk hospital, so that's all healthcare and medical staff. It's urgent care providers and those who might be administering vaccines from entities, right? 1B all first responders, all education workers, including daycare and college, public transit workers, all transit workers, so people who engage in sort of large-scale public interaction, people 65 years of age and older, homeless and congregate shelters, and public-facing grocery store workers. That is the list of 1A and 1B. Now, if you go to the next phases, Phase 2 includes all child care providers and other essential frontline workers that interact with the public or maintaining critical infrastructure. We would identify Phase 2, we would guess, would include those other kinds of workers that, Noreen, you've asked about. Lisa, are there concerns about inconsistencies students are experiencing? Are there new directives from state or school, city, or the county regarding schools open and closed? There's no new direction, but there's no direction to confirm the old direction either. The counties are not making any other rules as it relates to school opening. So originally, schools could open if they were below 5%, right? The county was below 5% positivity, and they would be forced to close if they exceeded 9% positivity. That has not been upheld. So schools can remain open in this hybrid model. They can remain open even currently if a county exceeds 9% positivity. The state has not required closure. Now, there is a testing component if there's an established zone. So it's, again, I know this is the best I can offer you. This is the state's direction. If you exceed 9% and there's a zone, then there may be testing requirements, but the state has not required that, didn't require it when we exceeded 9% and didn't give any new direction. So at this point in time, what I tell and have said to school superintendents, and we've been advising them for weeks, is the state has not altered its direction. Schools can remain open, can remain functional, and if there's a concern, the state will require some testing to prove or to show that positivity in the schools is less than the positivity rate in the surrounding county. I know that is a bit confusing and frustrating, but there it is. If there are any other questions, write them down in the comment section below the live stream. We're going to close up in a minute. I do want to again encourage you to follow those basic protocols. Remember those mitigation steps. Do those basic things. Slow the rate of transmission. Try not to get anyone ill. You don't want to get ill yourself. So continue to wear the mask. Continue to engage in that physical distancing. Wash your hands. Be cognizant and aware of your own health. If you're experiencing symptoms, stay in. And please be patient when it comes to accessing the vaccine. Joseph, why can't I go to my primary doctor instead of a pharmacy? Because the state has not certified your primary care doctor yet. And again, I understand it. This is not how we would roll out the vaccines. Keep in mind, the state of New York and the states control the system. That's everything from how you schedule to how many doses are coming into a community. That said, we work very closely. We're trying to get as many opportunities and as many places available. We have been pushing for greater certification among physicians, and at some point that will happen. But again, there are 1,200 doses in Dutchess County this week. There are 300,000 residents in Dutchess County. I don't know about this week, but there's 300,000 residents in Dutchess County. So right now, the state is not increasing certification for vaccine distribution until there is an increase of supply. But if you're interested in getting updates on vaccines, here are the two places that you can go now. Go to dutchessny.gov/COVID vaccine, click on the blue subscribe button, and you'll sign up. 25,000 emails signed up. You will get a contact, you'll get updated information emailed to you. As there is more vaccine information, this is how we will communicate it with you via email. If you're interested in knowing if you're eligible and interested in the state locations, the state of New York has established this website, ny.gov/vaccine. You can get there from dutchessny.gov, or you can call this toll-free number, 1-833-697-4829. We are pushing on the federal government to put more vaccines into the communities. We're asking the state for greater availability. It is true that the state has taken some of that allotment and moved it, in essence, to those regional sites. We have 2 local regional sites. One in our region is in Westchester. It is obviously not as easy to access for those of us who live in Dutchess, but there is a regional state site in Westchester. There is another regional state site in Albany, which has some proximity, certainly, for those living in northern Dutchess. Those are the 2 locations for general access. If you are 65 years of age and older, the pharmacies don't have a lot of capacity yet, but you are the only ones who can get your vaccine at a pharmacy. 65 years of age and older, you should visit your pharmacy's website to confirm availability, and we will, through that email you subscribe to, update you when that information when there's new information to share with you. We're also going to refine how we inform. We're going to refine how we inform you about vaccine distribution at the county sites. We have those locations open, but we only have 600 doses to distribute this week. But I do want to close today by extending my appreciation to the entire Dutchess County team and getting these locations up and functional. It requires everyone from the Department of Finance to our IT, to our emergency response, to our communications and executive staff, right obviously to the feet on the ground, and that is, of course, those folks at the health department who have been doing a terrific job, led by Kathy Tetmeyer and Joe Ryan, and a team of people who have gotten these pods up and running, but most particularly because they're not paid to do this. I want to extend our appreciation to our Army and Blue Vests, our Medical Reserve Corps, who've done tremendous work these last several months. But I can tell you, having now visited the pods and seen the distribution, there's these volunteers. They want to work more because they see this as the fulfillment of their duty, their responsibility. And I can only tell you, having lost a loved one to this virus, it is a way that we can give meaning to that loss, to give some lasting legacy to that loss that too many families and too many people have felt, is to make sure that these vaccines get to the people who want them. And so we're going to continue to advocate for that. We're going to continue to support those pods and continue to reach out. I do want to acknowledge 1 week ago, we did get a call. One person asked me to wish happy birthday, and we got his name wrong. I know exactly who we were wishing happy birthday to. So on behalf of Dutchess County, Michael Rao, happy birthday 1 week later. You're a great young man, and what I admire about Michael is he expresses his opinion on social media about politics, about sports, about anything, and he does it in a respectful way. Michael is one of those people that helps to remind us what it means to think differently. And Michael, happy birthday! Sorry I got your name wrong last week. Blame me. But nevertheless, a happy birthday to you. And to all of the Dutchess County residents, please be patient, all of you. Please, we're trying our best to continue to provide you information, to give you the answers to questions you have. As Dr. Nicastro said, there is light at the end of the tunnel. We agree. The tunnel, though, is so long. But we're nearly there. And we just ask you to be patient, to follow those mitigation steps, to be safe, to go get a test if you feel you've contracted COVID-19, or if you can, please continue to monitor for access and scheduling a vaccine. And I will say this, because we've said it all these times, every time we've been, I understand that these last several months have caused a great deal of anxiety and frustration. Throw in the mix all of this, some of the things that affect our politics. I understand all of it. I guess I've been around long enough to kind of seen a lot. But what I will tell you is that this community is at its best when we respect each other. And so your opinion is of value, but it is not more important than someone else's opinion. Everybody has the right to express their concerns, their interests, their opinions in a respectful way, and I would encourage you to do that. What we do here in this level of government is try to respond to people regardless of party or ideology, and we really encourage that among you. So, whether on social media or out in the community, just do your best to be respectful of differing opinions. We're all trying to navigate what just seems to be this onslaught of upheaval and information, and I just encourage you to be respectful of one another, to stay strong and stay healthy, and to be kind to each other. Thank you. We'll see you again next week.